my name is Michelle Rose, and I'm here to talk to you guys today about a nurse residency program for Broward Health. The objectives of this PowerPoint is to define a nurse residency program, identify the components of a nurse residency program, review the goals, examine the benefits, discuss the financial implications, review a cost-benefit analysis study, introduce VISIAN, American Association Colleges of Nursing Nurse Residency Program, which is one of the many options we have, and analyze technologies available in an NRP. What is a nurse residency program? A nurse residency program is a structured program that is designed to effectively transition a new graduate to the professional registered nurse role. The program offers the proper tools and experiences in a supportive environment to pave the way for a prosperous career in nursing. The components of a nurse residency program can include classroom education, computer-based training, hands-on activities, simulation experiences, peer support discussions, social networking, leadership development, evidence-based performance improvement projects incorporating information technology. This is when groups of residents will get together and do research within the hospital and design quality improvement projects. Structured debriefing and mentorship. I want to point out social networking just because I've had coworkers in the past who have said how much this means to them, because when you're a college student and you graduate and you go into your first real job and into large organizations such as Broward Health, it can be very difficult to assimilate to the environment. So this allows just for like a family to form, and for you have that close-knit community and everything. The goals of a nurse residency program are to enhance the critical thinking skills of the new graduates, improve organization ability, improve their technical skills, increase their confidence and their clinical decision making, foster an environment of teamwork, encourage the use of outcome data to promote patient safety, strengthen commitment of the new graduates to lifelong learning, enhance commitment to a nurse as a profession, and to create a stable workforce within Broward Health. There are numerous benefits of a nurse residency program, and some of them include increasing retention and lowering turnover, increasing nurse satisfaction, producing safe and competent nurses, improving patient outcomes, and studies do show this happens, promoting leadership, and increasing competition. Say we have a nurse residency program and Memorial doesn't. New graduates are definitely going to try to come to us over Memorial. The Institute of Medicine back in 2010 said in a report, Leading Change Advancing Health, that they recommended implementing and supporting a nurse residency program to develop a more competent workforce. So we're a little bit late in the game, but we need to get on it. So, as most of you are concerned, it is about the money. So that's why I wanted to go ahead and get together results of a study for you guys. So the research shows that statistics that show that the turnover for new graduates that are not a part of nurse residency programs is between 35 and 55%. High turnover leads to increased use of contract employees. And the cost of replacing a new graduate is estimated to be between $49,000 and $92,000 per nurse. This is obviously, dependent on the region of where your hospital is located. And studies have shown that nurse residency programs are associated with a decrease in 12-month turnover and reduction in contract employees. So if you see that this is how much it costs to train a new nurse, and there's a decrease in the turnover and reduction, then maybe it's something we should definitely think about. So let's get down to the money. All right, so a study was done on 15 hospitals across the nation using nurse residency programs. Their 12-month turnover went from a mean of 36.8% pre-residency to 6.41% post-residency. The turnover costs are here for the pre and the post residency and the savings. Same thing with contract labor costs, such as travelers. I used to travel. They make a lot of money, and but because hospitals have to spend it to, when people leave and they don't have anybody. But definitely, if you hire staff employees, it's definitely a cheaper way of doing things. So, turnover costs, $15 million savings. Contract labor costs, $33 million savings in 1 year for all these hospitals. So, we know that it's going to cost us to train the new nurses. It's going to cost more than our original nurse residency program that we have, our orientation program that we have now. So the study showed that per nurse, it was about $13,460 more to use a nurse residency program. And that does seem a lot, unless you look at this. So the total cost to use a nurse residency program in all these 15 hospitals was $7 million. But if you see here, just for the turnover cost of savings, $15 million. So if you take the turnover costs minus the additional residency program costs, annual net savings is still over $8 million. And that does not include the savings with contract workers. So the estimated total cost benefit of the nurse residency program, combining the turnover and the contractor labor use for all the 15 hospitals, between $8.1 million and $41.7 million. And I'm not saying that this study doesn't have some limitations, but these are very, very big and drastic findings. And now I want to touch on technology a little bit. Every nurse residency program needs to include a technology component. And some of the ones that are already out there, they include a component that assists the new graduates to effectively use information technology to safely manage patient care. We have electronic health records, decision support system, administrative systems, learning systems, all on the computer. We need to teach them how to use all of that safely. HIPAA, we want to be safe and teach these nurses how to be safe. And another thing I wanted to include was a lot of these programs that are already together and structured, they have a software format. So instead of those big old competency books, you can go online and your manager will have a password and code, and so will the employee, and so will the preceptor, and everybody can get on and log the progress, check off what she's seen, hasn't seen, what she's done, hasn't done, attended this meeting. And it's also really great for when you float, so you don't have to lug around a book with you, and then it gets lost, and then half the time the book never ends up back with the manager in the end anyways. But at least this goes all into one system, and when JCO comes around, you can see, oh, yes, this employee did complete all of this, and it was checked off by so-and-so. So this is a very, very important aspect that we want, if we choose one, whichever program we choose does include the software. And this is my favorite out of the research I've done. This is just one of the many options. This is the Vizient AACN Nurse Residency Program. This is trusted by 200 hospitals, health systems nationwide. It served more than 60,000 nurse residents, and the average retention rate for first-year nurses in this program is 95%. Organizations cite that the NRP helped obtain magnet designation, and that should definitely be every single hospital's goal, including Broward Health. Their evidence-based curriculum is focused on 3 key areas, that is leadership, patient safety outcomes, and professional development. And I wanted to end with a quote by the AACN. NRP empowers nurses, increases retention while reducing turnover costs. It's a program that yields improvements in patient care and safety. And just wanted to show you this pretty picture. I hope that Broward Health is the home of Broward County's next nurse residency program. And those are my references with all the studies. Thank you.